Hi, this is Dr. Villena. Today we're just going to Hi, this is Dr. Villena. We're just going to go over some quick review about GI disorders for pediatric population. I believe week 7 is a GI disorder for the IUMN, so let's just do a quick review here. Some general approaches for pediatric GI disorders. This is the most common complaint in pediatrics, abdominal pain. Abdominal pain you will see consistently in your pediatric clinic. Abdominal pain can be physical or mental health in origin. It could be psychosomatic. Abdominal pain is one of the toughest complaints to dissect in kids. It could be very benign. The abdominal pain could be very benign, such as constipation, or it could be something very acute, such as appendicitis. Like adult, when we approach abdominal pain, we have to know the anatomy as well. You have to visualize when you ask the kid or the parents to point where the pain's at, what are the organs that are there that could cause the pain, or what's a referred pain that can cause discomfort in that area. However, in pediatrics, not only do you need to consider anatomy and physiology when you're thinking about what is the cause of the abdominal pain, you also need to think about the age group. Different age group can have different common abdominal pain issues. So for instance, if I were seeing a 3-month-old female or a 3-year-old female with abdominal pain, STD or PID would not be in my top differentials. However, if it's an 18-year-old female who is sexually active and has an acute abdominal pain, I would definitely put STI and PID as 2 of my top differentials to consider. Some key points here. Determine if the pain is acute or chronic. Did it come on suddenly, or has it been progressively getting worse? Did the pain begin the last 3 hours and that's been worsening, or has the pain been ongoing for the last 3 months, the last 6 months, the last year? Determine if it's acute or chronic. Now, if it's acute, you want to determine whether it requires immediate surgical intervention or it's a benign acute pain. And you also want to consider red flags. Are there red flags such as high fever, lethargy, uncontrolled vomiting, blood in the stool, or signs of severe dehydration? So begin to consider red flags that you might see in your patient. Clinical pearls here. As I said earlier, not all belly aches are due to physical disorders. Again, it could be psychosomatic, and abdominal pain could also be something from the pulmonary area, or it could be due to a diabetic ketoacidosis. Sometimes abdominal pain in younger kids can actually be a sign of strep throat. So these, again, consider the age and what are the most common conditions for belly aches in that age group. As we begin the history, you want to use old cards or locates, right? Or the PQRST. You want to, again, this is a pediatric setting. One of the questions you always need to ask in addition to old cards is this child drinking and voiding, right? Because you want to make sure that the child is not dehydrated. You want to ask the hydration status. You want to ask if there's fever. You want to ask about activity level. Is the pain so severe that the patient cannot get up, right? You also want to identify whether this pain is acute, meaning that ask the parent or the patient, when did it start, right? Did it start a few minutes ago and is now worsened, or did it progressively get worse in the last 3 to 5 days? These are important questions to ask. The reason is that you want to determine whether this acute abdominal pain might need surgical intervention. About 5% abdominal pain in ambulatory pediatrics is acute, and of that 30% will require, of the 5%, 30% of them will require pediatric abdominal surgical intervention. So history is very important in helping you diagnose and identifying red flags. You want to consider, like I said earlier, age and gender, because they are important risk factors. And it will also help you determine uh, what is the etiology of this abdominal pain. You want to ask the onset, the duration, and timing. Is the onset acute within seconds? If so, that's typically associated with rupture, perforation, or an infarct. Is it a rapid onset pain? If so, that's typically associated with cholecystitis, intestinal obstruction, appendicitis, and ulcer. In rapid onset, that increases in pain that occurs in minutes, right? You also want to ask the location. Have the kid point to where it hurts if the kid can't, right? You want to ask, is the pain gradual? Did the onset occur over hours and days? If so, consider intra-abdominal etiologies. Ask about what makes it better, what makes it worse. Position, does the positioning of the patient makes the pain worse or better? Movement, does it make worse or does it make it better? The type of food, right? Does eating make the pain worse or better? What are the alleviating factors? What's the quality of the pain? Is it constant or intermittent? If it's intermittent, such as colicky pain, which can be described as short bursts of pain with increasing intensity that suddenly stops for a period of time, right? Is it dull or achy? Is it burning or stabbing? Is it pressure-like? You want to ask these questions because it can help you differentiate between a serious abdominal disorder versus a less concerning disorder, right? Trying to differentiate, is it severe enough, such as appendicitis, versus maybe just constipation, right? Or acute gastroenteritis. History is very important. Now, as you're listening to me, you're probably thinking to yourself, well, gosh, the kids can't tell me these things. Then you're right. So younger kids, 5, maybe even 5 or younger, can't really tell you much. So you're relying the parents and the caregiver to provide you a more thorough history, paint you a picture of what's been happening with this patient. So gather as much of the history that you can from the adults in the room. For pain, when you're asking the patient to rate the pain, use the Baker-Wong picture pain scale, right? The happy faces, that can help you. So next, I've got a chart here. These are the different differential diagnosis of abdominal pain by age. So here at 3 months, these are colic pain is very common. Pyloric stenosis, right? Between 3 to 24 months, 2 to 5-year-olds. And you can see that some of them such as strep, it's common from 2 years old to 11 years old. My kid suffered quite a few years ago. She just had an abdominal pain. She didn't have any sore throat. She wasn't having any coughing, but she had an abdominal pain and a fever. And the fever just kept increasing. The pain just kept worsening, and took her to the doctor, and sure enough, it was strep. So again, the pain, the etiology, does not necessarily always have to be from the abdominal area. This strep is caused by strep peritonitis that, we think about HENT stuff, but sometimes it can present as an abdominal pain only. Appendicitis, very common from the age of 2 to 18 years of age. Viral illnesses, right? Those are very common. As you get older, from 6 to 11 to 18, GERD is much more common. School avoidance is very common from 6 to 12 years old. Testicular torsion, very common from 12 to 18 years old. And as you get older into this age group, where if they're sexually active, think about ectopic pregnancy, PID, and STI. And for boys, testicular torsion is one of the consideration. Referred abdominal pain can occur with testicular torsion. So know your anatomy and physiology. Consider the age groups as you're figuring out your differential diagnosis, and correlate that with the history that's been provided for you. Here's an image here where by location, what are the most common conditions for abdominal pain? So right upper quadrant, we would think cholecystitis, pneumonia. Mid-epigastric pain, GERD. Milk protein allergies, more common in the younger kids, less than a year old. Peptic ulcer, common with more in the adolescent. Pyloric stenosis, more common in the babies, right? So again, know your anatomy. This is a chart to help you consider some of the associated symptoms for abdominal pain. So for instance, if you have diarrhea, consider the history that's been provided for you, and gastroenteritis, acute gastroenteritis, viral, is very common for pediatrics, especially during the flu season, winter season. UTI, if there's pain upon urination, blood in the urine, UTI is something you need to consider. I'm not going to go over this entire chart. You can take a screenshot so that you have this for reference. And I think this is also in your textbook. Some common pediatric differentials, very, very common. These are the top three that you'll see. Constipation, very common across the age group, typically defined as infrequent bowel movements. Sometimes you might see encopresis with constipation, where you have wet stools, and or stools in the underwear, poop stain in the underwear. So consider constipation with encopresis, very common as well when the constipation has gotten so severe. Acute appendicitis, and then gastroenteritis. These are common conditions for the pediatric differentials. Common PE findings for these diagnoses. So make sure to review your health assessment textbook and how to examine the abdominal area. So do a complete examination with the abdomen. Inspect, auscultate, palpate, then percuss. If you've forgotten how to do that, please review it. For acute appendicitis, you want to do several of the tests, such as the iliopsoas test, the Rosbang, use the McBurney, the referred pain, the heel jar test. If you don't remember how to do this, please review them. So if appendicitis is one of your differentials, you really should be doing these physical exam. And then gastroenteritis. Diagnostic tests of constipation, there's really not needed. Now, with constipation, several differentials you also need to consider. If constipation is your primary diagnosis, there are differentials you need to rule out. Obviously, differential for constipation is appendicitis. You also want to rule out hypothyroidism. Hypothyroidism is a must-not-miss diagnosis. Sometimes kids with constipation actually have underlying hypothyroidism. So you might want to check for the free T4 and the TSH or the thyroid panel. Celiac can be an underlying condition that's been missed in the past for kids with constipation. So one of the things you really want to ask is family history of celiac, right? So I'm trying to think what other differentials to consider for constipation. So you want to consider celiac, hypothyroidism, appendicitis, intussusception is another one you want to consider. Think about the age of the kid. And then acute appendicitis, obviously, differential for that would be constipation. So if you're thinking acute appendicitis, these are some tests that you can order. And then for gastroenteritis, I don't typically order tests for gastroenteritis. If it doesn't resolve after a week of seeing them, then yeah, consider this. Or if the patient and the family have traveled to a foreign country, you might want to do an ONP. So for gastroenteritis, several differentials for that obviously would be viral, parasitic, and bacterial gastroenteritis. Again, this was just a quick overview of common conditions for the GI. Things you need to, just to leave you and just to reiterate things. For pediatrics, you must consider the age and the risk factors when you're considering differentials for the child and when you're asking questions. As I said earlier, the most common is typically constipation and viral illnesses, gastroenteritis. We see that a lot. And the appendicitis is a must-not-miss diagnosis that we need to rule out for acute onset pain, especially with fever. And then with appendicitis, it's very common in younger than 5 years old. You really don't want to miss that because it can lead to perforation, abscess, and sepsis. history and physical exam can greatly narrow your differential diagnosis. And we don't but often we do need diagnostics such as x-rays, labs to confirm your suspicions. So if you're suspecting appendicitis and the patient has a positive MAC burning, you want to send that patient to the ED immediately so they can order their labs and their I hope this has been a helpful presentation. It's just a quick and dirty review of common GI issues. Please make sure to read the required readings for this week. And I hope this will help you with your IUMN for this week as well.